Hi everyone, Teresa Aker here from Success Diaries with Teresa Aker. It's my privilege today to introduce to you Gilly Kahn. How you doing, Gilly?
I'm doing well, Teresa. Thank you so much for having me on your show today.
It's my pleasure. Now I'm going to do a biography about you, Gilly. I'm going to come right back to you, okay?
Okay.
Gilly Kahn, PhD, is a clinical psychologist, mother, and writer. She specializes in neurodiversity and emotional regulation and provides individual therapy in Atlanta, Georgia. When she is not seeing clients or mummying like that, you'll usually find her writing probably about something psychological. Gilly's debut book, titled Allow Me to Interrupt, a psychologist reveals the emotional truth behind women's ADHD, is now available for pre-order. You can learn more about Gilly by visiting her website. So, Gilly, we have lots to talk about today. So, I want to start with where it all started. I know you have an extensive education, and what I was mostly interested in, as we discussed just before this, was that you're very much an expert in ADHD, and we hear a lot about it, but I think a lot of people are confused by it. So, can we start at the beginning, how this all got started, how you got interested in this field?
Yeah, so I would say it was pretty gradual for me. I was not diagnosed with ADHD until my early 30s. I was 33, so it was a few years ago. And it was really because I went out and I sought out the diagnosis for myself after really educating myself about ADHD. Because the truth is that even though I'm a psychologist, even among psychologists and psychiatrists and mental health providers in general, there's a lot of misunderstanding around the issue of ADHD, especially ADHD in girls and women. And unfortunately, it has been misunderstood in females for many years. And women have been experts who are older than me and way more established in the field have been making a case for more research and for people to listen more to women about their experiences. And hopefully we're starting to make more of a shift now, but this has been a problem in the field for quite a while. But for me, with the diagnosis, it was more recent. And that's because it has been misunderstood. But since I was 18, even younger than that, probably, I probably have had my suspicions that I have ADHD. I say 18 because when I was 18, I took my first psychology class. It was an AP Psych class. And that's when I decided I would major in psychology and become a psychologist. Before that, I really wanted to be an author. A writer. When I was 14, I would write stories for fun, fiction. But the truth is that I like writing stories, but I learned as I wrote that my best stories were the authentic ones where I either incorporated aspects of myself or I just went out and wrote about myself. That's why my book now is part memoir. It's just easier for me, I think, to write about stuff that I'm familiar with, and that includes areas of expertise. So when I was 18, basically I learned about the ADHD criteria. And as I grew older and I started studying psychology in college and through graduate school and learned about what ADHD was, I knew what it was, but something didn't click. And because the criteria were not written for girls or women or adults in general, it's really hard to, from the perspective of someone who's suffering through the symptoms, it's hard to say this is the diagnosis for me because the criteria right now just don't match that. So yeah, but I started working with neurodivergent youth when
Okay.
I was 19, and it started more with like autistic youth. So I when I was in college, it was just a coincidence. It wasn't something I was seeking out, but through a family friend, I started working in a school for autistic kids, and I had never, to my knowledge, at least 19, really seen an autistic child, or at least I wasn't able to identify them as autistic. So I didn't know what I was walking into. And honestly, I fell in love with them from here to the moon, as much love as there could be. And I never had an experience like that. And I knew I loved working with kids. That's something I've known since I was really young. I worked at camps and I was tutoring, and I knew sometime in the future I want to work with kids. But then it became more, I love working with this population, with autistic kids. And so it started there. And then I would request when I was in my practica in graduate school, I would say, I want the autistic teens. I would request them. Yeah, and I love doing like social skills training. My research when I was younger focused on relationships, friendships, parent-child relationships farther out into my studies. So yeah, that's where it started.
Perfect. So if I can go back then, Gilly, so I love that you like to work with autistic children. That's wonderful. That's a special area, I know, and there's such beautiful people, and it's wonderful. It's absolutely wonderful because I know for a long time we certainly didn't understand a lot about it. And I think, of course, today a lot of experts like yourself and people that just reach out and love that group of individuals who are able to have wonderful lives. They just need someone that understands and can help them through it. Would that be fair?
Absolutely. Yeah. In fact, I remember I don't know, I feel like it really takes a certain type of person, and I will say will take a neurodivergent person, which is why I think it's so important.
Yeah.
Whatever you're consuming, if someone else doesn't have lived experience, that's okay. They can be an expert and they can study about it. They can study the material, but they don't really get it. And it's not to downplay. I think there's a big movement actually that I've seen from like conferences I've gone to. For example, I went to an OCD conference in the past, and there's an autism like special interest group that I'm a part of, and I get their emails and they meet and they get speakers, or once in a while they'll have like just the members speak. And one thing I noticed, I remember when I went to the conference, was that a lot of the autistic members in the group were complaining that so many of the experts are not autistic. And so they're talking about
Oh,
autism in front of this group of a lot of many autistic people. And they're just, are we lab rats? Or like, why don't you get someone who's autistic to speak to us? And I think that's so valid. And so that's why when I speak to my clients and they say, "Oh, I read this book about ADHD and it was so depressing," then I usually point them to someone who has ADHD and who wrote a book, like Dr. Ned Hallowell, Edward Hallowell. He has a podcast called The Wonderful World of ADHD. And in my book, I talk about how it is a wonderful world. It isn't all depressing and a struggle. There's hope.
sure.
Yeah, so thinking about the optimistic side of it.
So let's expand on ADHD. Let's talk about the criteria. Let's talk about what qualifies someone to say, okay, I have ADHD. Can we do that? I don't know if you have to separate that, by the way, for children, teens, and adults. Is there, so I may be asking too much of you at the moment, but is it a general diagnosis or is it each individual age group has it? So can you help us with that?
Yeah, so right now, the way that ADHD, attention deficit hyperactivity disorder, is diagnosed is through a set of criteria that are divided between different presentations. And I'm saying presentations because the label has changed over time, just like the name for the condition has changed over time. So in the early 80s, it was attention deficit disorder. And so
Mhm.
that's why a lot of people say ADD. ADD is the same thing as ADHD. It's just an old way to call, like it's the old name for ADHD. Now it's just ADHD. It's just ADD 2.0.
Okay.
But it's referring to the same disorder. So in the 80s, it was ADD, and then it became toward the end of the 80s, ADHD, attention deficit hyperactivity disorder. And there are three different, at the time, there were three different subtypes. And types is different than presentations because it was thought that if you were diagnosed with a specific type of ADHD, that it would stay that way. That if you were diagnosed with a predominantly inattentive type, then that was your type, like for your lifetime. But then research showed that actually it's not so stable, that your symptoms can vary over time. So maybe at what one point in your life, like while you're a child, you're very hyperactive. And then when you get older, it transforms and it becomes more inattentive. Sorry, I hate these names, which is why I'm using all of these quotes.
I get it.
Yeah, so it has changed to presentation. So now the three presentations, which used to be considered types because they were thought to be stable, but now they're more fluid, are predominantly inattentive, predominantly hyperactive, and combined. And they're like what they sound like. So you'll see, like in the Diagnostic and Statistical Manual of Mental Disorders, I have it here. This is what we use in the United States.
Very good. Okay.
This is the 5. Now they have the TR. A little update. We're not on the 6 yet, but this is basically it's similar. But in the DSM-5, and I can't show it to you because it's copyrighted.
I understand.
Yeah, but there's 3 different presentations, and for each presentation, there's a list of symptoms. And if you're a child, you need to meet like 6 of those symptoms. And if you're an adult, you need to meet 5. And to be diagnosed with a predominantly hyperactive presentation, you would need to be diagnosed with, you would need to meet like that number of symptoms within that category. And examples of symptoms might include, and this is what makes it so silly and childlike, like climbs about in situations where it is inappropriate, right? So an adult would not climb in situations where it is inappropriate, right?
Unless they're
Um,
drinking some. No, I'm just kidding.
yeah, which someone with ADHD is likely to do actually. But yeah, so basically in the DSM, because the criteria, many people don't know this, but the criteria were written on and for samples of mostly little boys.
Yes, and I understand that because I have a son and he was quite different than my daughter's growing up when he was young. And in fact, the teachers said he was hyperactive, which is one of the symptoms you're talking about. And but he grew out of it. So as parents, we're not sure, are we?
Exactly, yeah. And when you say grew out of it, it's like maybe not grew out of it. Think about it. When you're a little kid, like your brain is not as developed as
Right.
when you're an adult. And so you don't have the same abilities or the ability to inhibit behaviors or the social awareness. I write about this in my book in a funny way, actually. I talk about how I actually at that same OCD conference, I was sitting in on a support group and I remember sitting in there and seeing this emotional support dog and seeing how it was just like rolling around on the floor. And it was at the end of the day. I think it was like 8 p.m., but I agreed to go and I just wanted to commit and be there. But I was tired. And so I was sitting on this chair watching this dog, wishing I was the dog. But of course, I didn't actually get up
Yeah.
and roll around the carpet, but I just thought about how nice it would be to like sit or splay out, lay down on the carpet. But I know not to do that. I know it's socially frowned upon. I have just like the control that an adult has not to do that. But a kid doesn't. If a kid saw the dog, oh boy, would they be rolling around on the floor, especially if it was late in the day and they were tired. So,
Can I
yeah,
ask you, Gilly, then, and you mentioned it, if we can come back to that, just, and I'll get off it in a second, but what is the difference? We do know, and I'm making a general statement, I'm certainly not a doctor, but we do know young boys do have more hyper energy and more tendency to do the things they shouldn't be doing than young girls. What's the difference? Can you tell me that?
yes, I can. Yeah, so there's a lot of stuff happening. First of all, male brain is different than the female brain,
Okay,
even
sure.
girls versus boys. And the basically in ADHD, in terms of why the symptoms look differently in boys, it's because girls, okay, so the prefrontal cortex, the front of the brain, is the part of the brain that kind of controls executive functioning. And executive functioning is your ability to inhibit those impulsive responses and to plan, to organize, to have a decent sense of time and time management. And girls' prefrontal cortices, they develop much more quickly than boys. So if you think about a classroom, if you have a class with a bunch of boys in it, it's going to be inherently rowdy.
For
And that's
sure.
why teachers love having girls in their class. They're much more collected. And so this assumption with ADHD now and in the past, but now it's fizzling out a little bit, is that girls are more space cadets, right? They're spacing out and they're in la la land. And my feeling, and I think a lot of ADHD experts who are women are also trying to push for this, is that we're not necessarily space cadets. It's not girls' brains are nowhere. They're usually being productive in some way
Yeah.
in their heads because they're either planning or maybe imagining like a new idea, coming up with a new concept, or if they have a special interest in autism, maybe they're thinking about different ways to deal with that. For example, when I was young, I loved writing. So I would usually think about my stories.
Okay. Okay.
I was crafting my next story.
Sure.
But also, it's not just this passive spacing out for all people or even all girls. It's also this internal restlessness. We're able to control ourselves, but we're dying in the process.
Oh, that's interesting. Now, so as we talk and as you were explaining it, so thank you. That was very thorough. What I'm thinking is, so now we go into teenagers, and I can certainly relate. We've all been teenagers, and the boys still, a lot of them still had that testosterone, that energy that was just pented up, and they did silly things. And we all know that. We know young teenage boys that do it, and girls, you're right, are more controlled. However, I liked when you said it's not that we're spaced out, we're just that internal turmoil is still there when
Yes,
we go through
that,
puberty,
yes,
what we express through puberty, and I'm thinking that matters for both boys and girls, and I think girls go through it perhaps younger, and you can correct me if I'm wrong, but I'm thinking they do because they have menstrual cycles and so forth.
yes.
Uh,
No, they do. Yeah,
yeah,
you're
so
right.
okay, so now the girls go through it sooner, but I have to admit, Gilly, now my generation, I'm certainly older than you are, we did not discuss this. We did not discuss the emotional side of
Right.
them. So now, and then we all went through menopause. I've been through menopause. So let's say you're 40 to 50, you're going through menopause. Now you have an all new area. But each of
Yeah.
those, I can honestly tell you, and I'll make this point about me, I can definitely say, as an expert woman, I had that out there feeling. I had that foggy brain, that daydreaming, that sort of process through each and every time I went through a change of life, whether I was pregnant, whether I was going through menopause, going through menstrual cycles, all of that. So were women being misdiagnosed or not diagnosed for ADHD because we just assumed it was a cycle? Would that make sense what I said to you?
Because we assumed it was a cycle. I think maybe it's not, it's actually the opposite of that. I think people didn't really care or they didn't want to spend the resources or the money on research on that. And we're only
Oh,
catching up. Yeah,
oh,
on is actually, I mean, I think you're referring to this when you get your period
mm,
or when you're going through perimenopause, like your estrogen levels are decreasing.
correct.
And estrogen is directly related to the neurotransmitters that are involved in ADHD. Everyone knows about dopamine, but there's more than just dopamine. There's acetylcholine, there's GABA, there's serotonin, and all of these neurotransmitters that help us stay on top of our game. They're all plummeting in alignment with estrogen
Yeah,
plummeting because of our cycles. And actually, I talk about this in both of these magazines. So this one's out now. It's the ADHD special issue on girls and women.
perfect.
And
Okay.
yeah, it's available online and it's also in grocery stores, Barnes and Noble, and it's limited edition. So that's why I'm saying it's available now in stores, but it's going to stop at some point. But there's an article here. I didn't write that one, but it's about hormones and maybe there are a couple. I know there's one on menopause. But yeah, that was a big missing piece. And what I was going to say was in my article, I kind of highlight in the introduction, it's this one, Out of the Shadows. And then I have a similar,
Is that the one you wrote, Gilly?
yeah, yeah. I
So
wrote for it.
can you read the first intro just for the audience? Just read the intro there. That would be great. What
Sure.
you
Yeah.
wrote.
So this one's titled Out of the Shadows. ADHD looks different in females. With this new understanding, we can finally start to diagnose the girls and women we've been missing in time to help. And then I wrote like a similar article in this one. This is the first issue that came out, but it didn't specialize in
Okay.
women. girls and women. But I think maybe the part that I wrote about girls and women being missed in this magazine was probably a big part of what fueled the second one. But what I wrote about was just the neglect of
Yeah.
studying women specifically in healthcare, not just ADHD. It really is absurd. And scientists have even neglected to study female rats or animals. And yes, in the initial like experimental designs or when they're trying to test whether a medication is working, usually they start with animals for ethical reasons. But they won't even include female animals because they claim that the menstrual cycles of these mice or rats, they interfere with the stability or like the predictability of their research designs. It's
We have a long
ridiculous.
way to go, don't we, Gilly?
Yeah,
That
yeah.
is incredible to me. That's something I never knew. I think you're right. The research and the money that goes into some of these things, we have to look at the whole picture and say, okay, we're not doing enough research in some of these areas for women. We know there's something. We know there's something. We're going through emotional turmoil and there's something going on, but we're not getting the help, I think, from doctors. And that's again a general statement. Some doctors are terrific and they're on it, but in general, I don't ever remember doctors talking about ADHD in adults
Especially in relation to hormones. Yeah.
and even in menopause, it's okay, you need some estrogen. Okay, we get that, but give us more than that. Talk to us about it.
Yeah, yeah, exactly. Yeah. And the other problem, we were talking about the criteria right now, the diagnostic criteria since the DSM-5, right now we're on the TR, but the DSM-5 was released in 2013. And since then, and even now, the cutoff for the age of when the symptoms should have been present, basically one of the criteria is that the symptoms must have been present before age, or at least before age 12. That's what it says. Before age 12. It used to be like before age 7, and then they said that's neglecting girls. But even 12 is neglecting girls
Right.
because what if you get your period at 12? And then your symptoms becomes much more evident because you started your period and maybe they were there, but they weren't so disruptive. And so you're to say that the cutoff is 12, that also is, I think, neglecting girls.
It does. So that's very interesting, Gilly. So are you doing research in that area?
No, I'm not doing research right now. I'm a clinical psychologist.
Just okay, which
Yeah,
is
I just
important.
know
So
about, yeah,
that's
I
so
know about
important.
all
Don't
this
stop.
stuff. Yeah, yeah. No, I work with people, and I write about some of my cases
Okay.
in my book. So it's applied, but also I was trained as a researcher. I was a PhD student before I got my PhD. I got a master's, like a separate master's in experimental psychology, and I published an academic paper on friendships and adolescence. And I still stay in touch with my old mentor, and I might contribute to like more work on that. But I've done like a lot of psychological testing. So I don't know. I guess I've dabbled and I've just been exposed to a lot of this work. So I'm familiar with it, but mostly I know a lot about this because one, I wanted to learn about myself, and two, because I chose to write a book about this.
Sure, absolutely. And well done. I must congratulate you. You're definitely experienced, you've had the education, and you have compassion and understanding and a passion for what you're doing. So that matters. Absolutely, 100%, Kelly. I'm sure all of the people that you work with just are so comfortable because you're very personable, you're knowledgeable, and you do care about what you're doing. I can tell you're a caring person with your patients. So thank you.
No, thank you. That's
Uh,
really sweet to hear.
No, absolutely. I could tell. Now, from there, where are you going in the next 5 years? Are you going to, what are you going to do with the ADHD expertise that you have? Where do you see yourself going with that?
Oh my God, my heart nearly jumped out of my chest. When you ask someone with ADHD, like, what are you going to do in the next 5 years? It's like a bomb goes off. I don't know. I just take it day by day. And the thing is, with my book, like, I knew I wanted to publish a book since I was
Sure,
very young,
sure.
but I didn't know when I was going to do it. I just felt like now is not a good time. I'm getting a master's. Now is not a good time. I'm
Yeah.
getting a PhD. I don't have time to write right now. And then if I wrote, what would it be about? And then I write about how I decided to start writing it, like in the book, but it was an interesting situation. It really just was like, all right, I'm going to do this now. And I just started doing it. So in terms of the next 5 years, I don't know. I will say it's funny because I was listening to, I do this before I come onto a podcast. I'll listen to some of the older, the more recent episodes. I want to know who was on the show recently. And the one woman who you just had, the psychic.
Oh, yes, she
Yeah.
was great. Yeah. That was
Okay, so
Angela
I
Thomas, right?
yes.
Yeah, she
So
was
I
great.
actually, yes, it was a very interesting episode. So yeah, this book is about ADHD. I don't know. The thing is with someone with ADHD is I have expertise in this. Sometimes I devour like information and then I just feel like I need to vomit it all out and
Oh,
then I need to read from it. And I need to do something else
yeah.
and then I come back. So I'll probably continue writing about ADHD in the background, but I'm actually thinking for my next book to write about consciousness.
Oh, that's interesting. I've had a lot of specialists on consciousness on my shows,
I
and
know. I'm
I
gonna start taking notes.
I know I'm fascinated by it, and I have more coming, so you're going to want to watch it. I am fascinated by that. I think it's because we definitely know there's more to the world than just this. And so when you go inside, and we're all about meditation and mindfulness and all, we understand all of that, but there is something more to it. And so good for you. I'll be reading that book. I think that would be excellent.
Yeah, it is interesting. As I was like preparing for this show, I was like thinking, I was like, oh, it's funny. We're always thinking, like our brain just doesn't shut up. But I was thinking, how do I explain executive functioning? I want to make sure I explain it clearly. And then I was like, we have like visual spatial skill difficulties, like spatial issues. And then also I was like planning issues with time management. And then I was like, space time, Einstein. Oh my God. I think there's something about, and I have an article about this actually, because I've always been interested in this subject. I mean, not
Oh, this
always.
is great.
Yeah, I wasn't born interested in the subject, but I lost my mom when I was very young. And so I've
I'm sorry.
always looking for an answer. But this is the article that I'm talking about. It's going with the flow.
Oh, okay. Very good. Now read the first part there. Go ahead and read that for us, Gilly. Just the under the subtitle there.
When women with ADHD unleash their wandering minds, intuition, imagination, and creativity soar to new heights. Yeah, so I just have a sense that people who are neurodivergent, autistic, ADHD, there's this openness, I think,
Oh,
to
absolutely.
their minds. And when you think differently, when your brain is wired differently, that's where savantism comes in, or for people who are autistic mostly, but synesthetes, there's all of these abilities that are very unique that I see in these differently wired brains, like neurodiversity. And so there's still a connection to it, but I've always been interested in the question of what happens after you die, and people are very polarized about this subject, but I've been listening to lectures about William James, which is
Okay.
yes, the father of psychology in the United States. And he did research on, I don't know if you know this, but he did research on mediums.
I do. I actually do. And I've heard of him and I knew that. I'm all about that. One of the books that I read that actually delved even deeper into, it was Dr. Joe Dispenza. Now, I realize whether you know him or not, he talks about the same thing you're basically talking about, but he physically had an accident and he had to use his brain basically to come back. So whether people believe or not, I think just the very fact that he shared that and brought it out. So authors like that, Gilly, I absorb those books.
Yeah, yeah. So it's different. It's different. I think it's maybe there is a relationship, and because I'm interested in the brain. Yeah, and I'm interested in also like creativity and intuition. One of the studies that I write about in the article in the magazine that I showed you was a Chinese study where they basically wanted to see whether women were more likely to respond to like challenging or like ambiguous questions using more of their like intuition or like gut responses than men. And they found that men tended to be more analytical, women were more intuitive. But then here's the fun part. Even though women were more intuitive, they were also more accurate.
Oh, is that right?
Yes.
Ooh, this is
Yeah.
going to be fun. Gilly, I want you to do the research and do the book. I can't wait to read it.
Yeah. Yeah.
I love this stuff. I truly do. Anything to do with the mind and how it works. And I do. I love, but I think that, so I've never been diagnosed with ADHD. Perhaps a lot of people have not, but I'm pretty sure there's lots of people walking around thinking there's something different about me that we just haven't labeled it yet. Right? Yeah,
Yes.
100%. And you're one of the great people that are working on that. So thank you for sharing everything today. Now, I have another question for you, actually, two. So if somebody wanted to reach out today and get a hold of you, what's the best place? I'll certainly have all your information here, Gilly, but what's the best place?
Yeah. If you visit my website, drgillycon.com,
Okay.
you can reach out to me through there. You can send me a message. You can also find me on social media. Right now, I'm on several platforms, but the one I use the most is Instagram. So my
Okay.
handle on Instagram is at Dr. Gilly Kahn.
Okay.
Yeah, those are the two best ways to reach me.
And I had a great time with you today. I have one more question. Will you come back and do another show?
Oh, absolutely. Thank you
I
for
would
inviting
love
me.
that. And we have so much more we could talk about in this, and we could talk about consciousness.
No, we just scratched the surface for sure.
So I would
Unintended.
exactly. Exactly. I love that. You were wonderful today. I truly appreciated having you here today. And I know everyone's just going to love watching you. So thank you again, Gilly, for being here. And to everyone else, this is Teresa Aker from Success Diaries with Teresa Aker. Please go over to Gilly's sites, take a look, go to her Instagram, make sure you check it out. If you have any questions, go ahead and ask her. And you can certainly ask me, and I'll make sure she has all your questions answered. And go to her site and get her book. So then you can learn more about ADHD. After that, I wish that you all have a wonderful day. Please subscribe to my channel. Have a great day, and I look forward to talking to you all very soon.